So hello, and thank you for joining us again for another episode of Can I Ask a Question? Our guest today is Dr. Barbara Smith-Nash, MD, and I am so grateful and honored that she took the time to come on over here and sit with me and discuss some of the issues that are arising for women, especially Black women. And as I had stated before, Dr. Smith Nash, that I have recently lost weight. And due to that weight loss, it was a concern about hypertension. I was at level 2, stage 2 is what they had called. And on that day, I think my blood pressure was about 159 over 90 something. And so they kept taking it and taking it. And finally, they moved me into a room where they turned the lights down. And in my mind, I had stuff to do. It just was taking too much of my day. So that became an awakening to me how I really was responsible for taking care of my body. So, Dr. Smith Nash, if you could please do us the honor and tell us a little bit about you, because again, I do not want to overlook you and all of the great work you do for our communities and for the love that you share, not just the medical, but also your philanthropic heart that you also share with us. So if you could please share with our audience a little something about you. Thank you.
Thank you, Sora Colette, and thank you for inviting me to share this information. As she said, I'm Barbara Smith-Nash, and you can just call me Dr. Nash without the Smith. I did my medical residency in Fresno, but I went to med school at UC Davis. And I've worked in the community all around in Sacramento. Once I left my residency in Fresno and moved back to Sacramento, I probably worked every clinic that you could probably think of. And during my time, my specialty was family medicine, but I also did OB. So there was a time when I seemed to have delivered half of the babies in South Sacramento. And now they're grown and they have children, and I can even see their grandchildren. I have been retired now from UC Davis. I worked there for 35 years. And so like you said, I affiliate myself with other organizations such as Alpha Kappa Alpha, the Links, and also with the Seroptimus, which is also a philanthropic organization. I hear my phone ringing in the back.
Oh, it's okay. It's all right. We live real life here. We live real life.
Okay. What I will do today is try to share with you in 15 to 20 minutes something about what we call the dangerous duo, and that's hypertension in Black women and diabetes. First, I would like to start off by talking about knowing your numbers. And I think Colette mentioned her blood pressure was a stage 2 at 159 over, what was it, 90?
90 something, yeah, I can't remember the bottom number, yeah.
And what we should be, our goal should be to get it down at least to 130 over 80. If we can do it without medication and diet and exercise, that's wonderful. But many times we can't, because one of the things that's against us as African-American Black women is that genetics. My brother had a stroke at the age of 58 and died at the age of 60 from high blood pressure. My son in 2020, who was 52 years old, had a massive stroke where I found him in the garage down, had to call 911, took him to UC Davis, and he couldn't move any of his extremities. His brain had swollen. And what I found out was that 2 years ago, he had been told by a doctor that he had high blood pressure, and he ignored it. He thought if he did more exercise and kept eating the same diet, that he would be okay. Well, it didn't work. He is still in rehab. It's going on 2 years, 2.5 years. He has regained his hands and his right foot, but he's still unable to walk. So every day I suffer what he suffers, and he's on medication, and he's doing well. He has his brain faculties back, but he still has high blood pressure.
Now, why is it called the silent killer? So if I had not gone to this doctor's appointment, which had nothing to do with the high blood pressure, I was having something else checked. If I had not have gone that day, what other alerts would my body have given me that there was a problem? How would I have
Well,
known?
go ahead. One of the things that happens is that some people have headaches and some don't at the beginning. Their vision changes. They may have swelling in their feet and legs, shortness of breath. And when we get to that stage, we're probably almost to stage 4. So go ahead.
No, I just said, wow, like we went
Right.
from just finding out to all the way to stage 4.
4, right, exactly. And if you will notice in dialysis, in the dialysis centers, there are more African Americans. 32% of them are African Americans because they've ignored it, just like my son did. And I'm glad you went. And they thought they had a solution without going to a doctor. And many times the solution is not just exercise and a diet, but we have to take medication. Because remember, I'm telling you, genetically,
Yeah.
we are more apt to have high blood pressure.
So why are we finding it more within the African American community women? And why is
Mhm.
it more in areas of what we would say disparity? Why are we seeing the numbers fluctuate up higher for Black women in areas of disparity?
It goes back to our genetics. First, genetically, my father had high blood pressure. Now, to give you the opposite of that, my mother lived to be 97.
Okay. Wow.
And in her right faculties, and she had high blood pressure, but she didn't have diabetes. And like I said, the dangerous duo is usually hypertension and diabetes. And it seems like we as African Americans, our diets have a lot to do with it other than genetics. We eat a lot of food with salt. We
Okay.
cook a lot with salt. And when I was getting ready to get this half a day, and it says 1,500 milligrams. And what does that boil down to? One teaspoon, one
Okay.
teaspoon of salt, especially if you already have high blood pressure. Now that's very difficult to do because having my mother around me, I had to, control her diet as well. And at first it was very difficult. Food, what does it taste like without salt?
Right.
We cook greens with salt pork,
So, what I
and
was gonna say, salt pork.
and then
Right.
you cook other foods with pork. And the reason we tell you not to use pork is because most pork is preserved in salt. So in order to sustain pork, whether it's bacon or ham hocks or whatever, it's all cured in salt. And so why is salt an enemy of the
Yes.
Black woman or the Black
Why is that?
community? Because with salt, water follows.
Mm,
Always when there's salt, water comes into play. And
wow.
then, and that is the makeup of what salt does. Salt brings in water, and water gets around the heart. And I know you've heard of congestive heart failure.
Yes, my
Even in the
mother recently
Bible,
had it.
it talks about dropsy, and that was congestive heart failure, where the legs swell, the feet swell, you become short of breath. And of course, obesity, being overweight, the kind of diet. We love sweets, we love cakes, and we bake, and we do this and we do that. If you could see what people eat every day, and you said, why in a community of disparity? It depends on if you live in a community where there's a, a food desert, where there's not a store where you can get fresh vegetables and those kind of things that we need to have a healthy diet. But we can take what we have and make a healthy diet. if you're going to have greens, then don't put in salt pork or ham hock, but try to
Oh
use
no.
like smoked turkeys, which has no salt on it. So that's one of the things. And I think you had another question. Go ahead.
Oh, yes. So I was one of the questions that was presented to us was, have you seen a rise in diabetes and hypertension since the pandemic, the introduction of the pandemic? Because I think we still are under a cloud of the pandemic, but have you seen, or has the medical world seen a influx of hypertension and diabetes?
I think, I'm retired now, so I'm not out there seeing patients on a daily basis. But I think they have, because of what the pandemic has done to us. And I say to us, one reason, we say, why the pandemic? The pandemic stopped us in our tracks so we could have a heart check. This gave us time to evaluate our health and our diets and exercise kind of things. And stress, the pandemic has provided us with more stress than we already have, especially as Black women. The young women that still have children wondered if they were going to be able to go to school. And if they are in school, do they have to wear a mask? Do you have to have a vaccine? And there are many that objected to getting a vaccine. And I've had patients say to me, well, it's in God's hand. Yes, it's in God's hand. And we stand on God's promises. But I told them to always remember, God always has a plan. With
I
that,
like that.
that plan was vaccination.
I love that. He always has a plan. Even
Always
in the
a plan. Yes, he
even in
does.
the midst of a pandemic, there's a plan.
There
Yeah.
is a plan, right? And so again, we go back to what we teach: diet, exercise, loss of weight will reduce your blood pressure. If it won't, then you can take medication. However, you must remember medication has multiple side effects. Correct. Before they could find a blood pressure medicine that would control my blood pressure, I think I went through 15.
15?
15 different ones. And I'm on one now that's making my hair, I always had a lot of hair, but it's making it thinner. And I'm using it. And so, they all have side effects. They can give you joint pain and all those kind of things.
And I was reading the side effects as you stated, and I thought, well, I mean, my Lord, the side effects sound far more worse than what my body is experiencing. So, like you said, you had to go through 15 before you found one that your body was able to interact with, but there are still some slight side effects.
Yes.
How would you say that the diagnosis of hypertension or one that may have diabetes, how is that affecting their mental wellness? But what do they also need to do to bring forth self-care to make sure that they're totally taking care of themselves?
Well, one of the problems that we had during the pandemic is getting in to see a doctor. And if you haven't had a physical, then you don't know what your blood pressure is. And there are other numbers that we need to be concerned about as well, like our blood sugar and our cholesterol and the breakdown of what cholesterol means. But if you can get in now to get a physical exam to see what your blood pressure is, and just like you said, yours was stage 2, stage 3 goes up to like 160 over 90 to 100, and then beyond into stage 4, which can be at 200 over 100. And the normal blood pressure for whites, 120 over 80. Our goal should be to try and reach that.
So you said, because I think the system went out just a tad bit. You said for another population, you said for the white population women, it's at
Mm,
what?
120/80.
120/80, but for the black woman, it's quote unquote normal is should
Well,
be.
not normal, but it's acceptable to have as high as 140/90. But I disagree with that because we have seen damage in the body even at 140/90. We
Wow.
have seen people have a stroke at 140/90.
140/90.
So if we can get it down, the further we can get it down, 130/80 is, I accept that in my patients, even if they're on medication. That's what our goal is. That's
So
what
140.
is, yeah, 130/80. Yeah, is acceptable.
Wow.
Right.
That
Mhm.
that that brings a more enlightenment to how we should be taking care of us. And as you said, the greens kind of are a staple. And, I look forward to it around the holidays. And yes,
Mhm.
throw the ham hock in, but I have removed the ham hock and now it's the turkey. So yes, but it was a learned behavior. It was something that I grew up with. And if you didn't have a ham hock in it, it wasn't right. It wasn't normal and you didn't eat it. But now we've changed that diet. But if I am a woman who has suffered um, the high blood pressure or I have been diagnosed with diabetes, what can I now do? I'm exercising, I'm changing my diet, but what else can I do mentally and through the self care process to restore my body? Because I don't want it to decline. I kind of wanted to kind of renew itself and rejuvenate itself. What type of food should I be eating also?
Well, first of all, you should, uh, if you can, and usually associated with whatever medical plan you have, is a nutritionist who can go over dieting with you. One of the things that we as African American women and African Americans do is we have a high intake of carbohydrates. And so carbohydrates become sugar in the body. And when they become sugar, it saturates the blood system with sugar. And what happens is that sugar goes and it can't be motilized or moved or metabolized to make energy. So what insulin, which is a hormone, does, it takes the carbohydrate that you ingest through your diet and move it into the cells so we can have energy. But if
Mm,
you don't have enough insulin to do that, then you're going to end up diabetic.
diabetic.
And we test that with a test called hemoglobin A1C. And the reason we use hemoglobin A1C because it tells us what our sugar has been over the last 2 to 3 months.
Oh,
What
okay.
used to happen is that somebody would know that they're going in to see the doctor and they would kind of cheat. They would, for a couple of days, they wouldn't eat any sugar. And when
Trying
they
to
came
bring it
in,
down.
right, and so when they came in fasting, we would test their blood and it would be normal. And yet they were having symptoms of diabetes. And you say, what are the symptoms of diabetes?
Yes.
Usually when you first start becoming thirsty a lot,
Mm.
you crave water or some solution to get rid of that sugar in your body. Then it
Mm.
affects the kidneys. That's why there's so many people of color that are in dialysis centers
So is it
because,
because of soda intake? Is that because there's more soda or is it less water?
well, neither of those. It's because what happens when you get into too much sugar in blood, it affects the kidneys and scars the kidney, and the kidneys become what we call dysfunctional, not able to get rid of waste,
Wow.
such as water and fluid. And
Mm.
one of the things that I was looking at, people talk about, one of the things that we take you off right away when you're diabetic or even with high blood pressure is soda water.
Hmm.
And so I said to patients, I said, why do you think they call it soda water?
I was
Soda
just
is
laughing that you called it soda water.
right. That's what, and the patients that are coming from the South, they refer to it
The
as
soda
soda water.
water, yes.
And I said they call it soda water because there's so much sodium, which
Mm,
is salt,
salt.
that impairs the kidneys and gives us, puts us more in risk for heart disease.
Oh, Dr. Nash, Dr. Nash, Dr. Nash, you are bringing so much insight to some of the most simplest things because, like
Mhm,
you said, from the South, I've always heard it called soda water and
mhm.
never circle back around to why was it called soda water because of the high sodium in that water. So
Right.
thank you. That was like, all right, that was a little that would be a great what do we call those questions when you're having games trivia question, why is soda
Right.
water called soda water? That would be a good one.
Exactly.
But thank you. So I really appreciate this time together, and I know you have another appointment, but is there anything else you want to share with women about taking care of their bodies and the importance of our daily interaction of how we can sustain and not participate in hypertension in the various stages of diabetes? What can we do to make a change?
Well, first of all, education is one of the keys. The education, either from your doctor or someone that is in the know about hypertension and diabetes. Also, we didn't get much chance to talk about mental health and what has happened to us as Black women during the pandemic, the stress that we're under with our children, grandchildren, financial stability. All of these kind of things point to mental illness. We're considered the superwoman,
Right.
right? And we keep everything inside.
Yeah.
And right, we don't talk to people about what's bothering us because we're so busy taking care of
Care of everybody
everybody
else.
else. Right. So
Thank you
it
for saying that. Thank you for
right.
being transparent with that. And not to deviate from what you're saying, we are seen as the superwoman.
Mhm.
However, these shoulders are getting tired.
That's right, right.
Getting
So I
tired.
tell people, especially African American women, be Atlas shrugged. So shrug
Mhm.
your shoulders and let it fall off.
There you go.
Right. Talk
my
to
mo-
somebody.
my mother-in-law would always say, "Be like a duck and just let it roll off. Like don't hold it, just let it roll off."
Let it roll off because you can't solve all those problems. And it is true. Do what you can do. And, we pray and God hears us. But, He gives us, like I said, He gives us a plan and we need to follow that.
Yes.
Mhm.
Oh, I don't want to cry, but I feel that coming because for those of you, as you can see the AKA in the back, we
Mhm.
are sorority sisters, but not just the tethering of being sorority sisters, but the tethering of wanting to educate the community, wanting those women out there to know that there's someone that cares and they hear what you're saying. And that Dr. Nash said, you need the education. So, as this platform, we're utilizing Can I Ask the Question to educate you and give you more information because as a woman, it is vital, vital. You have your family, your community, your friends, your loved ones, and they want you to be around. And so, whatever we can do to help to give you that information, we're going to do it. And I know Dr. Nash is affiliated with many organizations and they are making a change in the lives of many out there. So before we end, Dr. Nash, is there anything else, any magnificent nugget that you would love to impart on us? Because this is about inspiration, empowerment, and motivation to change the lives of others.
Yes, if you have a chance, any of you, look at the DASH diet. This is a diet that approaches stopping hypertension. And it talks about how much salt and what you can do. And you can make your own DASH diet. Go on your iPad or your computer and put in DASH diet. This can help you quite a bit. And also look at those carbohydrates. There are people who don't know what carbohydrates are. It's that white bread you eat. It's those biscuits that you like. It's that cornbread that I like. All those kind of things, and and all those cakes that we bake around Thanksgiving and Christmas. And some people will say, I only eat it during the holiday.
Only the holidays.
Yeah, but that's just enough to get you started.
Yes,
So,
it is.
and so if we can look at ourselves, if we can stop and do a heart check with us, we can help those under us, our children, our grandchildren that are coming along behind us.
I love that. And I hear what you said about the heart check. So when we're thinking about the heart check, it also is not just about the diabetes, the prevention of diabetes, the prevention of hypertension. It's also checking our heart too to see how are we living,
Yes.
our mental wellness. Are we really taking care of self? And then, like you said, Dr. Nash, that's also a role model for our children, our community, those that we may fellowship with at church. They'll be able to see, oh, there's a change. And then you're able to share, yeah, I had to remove the soda water because it has sodium in it. So I'm going to use that one. I'm going to be stuck on that one for a while.
Okay,
I'm going to be stuck with that one. Oh my goodness, that was so great. All right, so DASH diet. So, ladies, please make sure, as Dr. Nash has shared with you, and is there anything else you would like to share before we end?
No, I know my time was limited because I have
No,
another
you're
meeting,
good.
but I tried to present it simply so some things would stick with you. And again, it gets back to the old way: diet and exercise and prayer, of course. And
Let's throw that in there.
so I don't have anything else to say. And I thank you for allowing me to share this information.
Yes, thank you. And so again, I was saying when Dr. Nash agreed, I was so excited because of her contribution to us. And I had coffee with a dear friend the other day, and I told her who I was going to be speaking with this morning, and she said she delivered 4 of my babies, and then we just started laughing. Like I said, that's her. So as you stated, you have delivered many children, and she is now a grandmother herself. So it's funny to see that. So again, there are no words or expressions that I could share publicly or privately how much I appreciate you and all that you do. So again, thank you for joining us today on Can I Ask the Question with Dr. Barbara Smith-Nash. Thank you.
And thank you.